Welcome to the Certified Professional in Healthcare Quality Exam Prep video. In this video, we will explore how to participate in identifying or selecting measures, example, structure, process, outcome. We'll discuss the steps to identify or select measures.
Introduction.
Participating in the identification or selection of measures for performance and quality improvement in healthcare involves a careful process to ensure the measures are relevant, actionable, and aligned with the organization's goals. Measures typically fall into three categories: structure, process, and outcome. Here's a guide on how to effectively participate in this crucial activity.
Steps to identify or select measures.
1. Understand the types of measures.
Structure measures. These refer to the organization's capacity, systems, and processes to provide high-quality care. Examples include staffing ratios, the availability of specialized equipment, or the physical infrastructure of a healthcare facility. Process measures. These assess the methods of providing care and how well care is delivered according to accepted standards. Examples include the percentage of patients receiving preventive screenings or adherence to clinical guidelines for chronic disease management. Outcome measures. These evaluate the effects of healthcare on the health status of patients and populations. Examples include patient mortality rates, infection rates, and readmission rates.
2. Align measures with organizational objectives.
Strategic alignment. Ensure that the measures chosen are closely aligned with the organization's strategic objectives, such as improving patient safety, enhancing care quality, or increasing patient satisfaction. Stakeholder input. Engage various stakeholders, including clinicians, nurses, administrative staff, and patients, to gather input on which measures are most relevant and impactful.
3. Evaluate measure validity and reliability.
Evidence-based. Choose measures that are based on strong evidence and supported by research to ensure they accurately reflect quality and performance. Reliability testing. Verify that the measures are reliable, meaning they consistently produce the same results under the same conditions.
4. Consider data availability and feasibility.
Data access. Assess the availability of data required for each measure. Determine if existing information systems can provide the necessary data or if new systems need to be developed. Feasibility. Consider the feasibility of implementing measures, including the cost, required resources, and potential disruption to clinical workflows.
5. Pilot test measures.
Small-scale testing. Before full implementation, conduct a pilot test with selected measures to identify any issues in data collection, analysis, or interpretation. Adjustments based on feedback. Use the results of the pilot test to make necessary adjustments to the measures, data collection methods, or analytical techniques.
6. Develop a monitoring and review plan.
Continuous monitoring. Establish a plan for ongoing monitoring of the measures to assess their effectiveness in capturing quality and performance. Regular review. Schedule regular reviews of the measures to ensure they remain relevant and aligned with healthcare best practices and organizational goals.
7. Educate and train staff.
Training programs. Develop training programs for staff involved in data collection and reporting to ensure they understand the importance of the measures and how to accurately collect and analyze data. Feedback mechanisms. Implement mechanisms for staff to provide feedback on the measures and suggest improvements based on their frontline experiences.
Conclusion.
Participating in the identification or selection of structure, process, and outcome measures is a dynamic process that requires a clear understanding of organizational goals, rigorous evaluation of measure validity, and consideration of data feasibility. By systematically engaging with these steps, healthcare organizations can ensure that the measures they adopt are effective, meaningful, and capable of driving significant improvements in quality and performance. If you found this video informative, please like, share, and subscribe.